Hello there, my name is Dr. William Bird. One of the questions came up is, can you be shedding virus when you're asymptomatic? It's a really good question, and still we don't know exactly when someone is shedding virus at the beginning of an infection and at the end of an infection. So currently the guidance is that you are probably shedding virus for a few days before the symptoms start. That's a real difficulty because obviously you don't know anything about it and nor does anyone else. And then you get the symptoms perhaps 2 or 3 later. So being careful who you've been with or tracking someone who you've been with for 2 or 3 days beforehand just makes sense for them to be just careful about being isolated themselves, because they may well get the illness 5 days later. If you get better, what we find is that some people get better after about 6 or 7 days, and then they start getting a shortness of breath and sometimes a cough that carries on for a long period of time. Now, we don't know whether that is still meaning you're infectious. The advice probably is this. So Public Health England say that while you have a temperature, you are shedding virus. If that goes on beyond 7 days, you are still shedding virus. So forget about the 7 days bit. If you've still got a temperature after 7 days, you are still shedding virus. After that, it gets a bit more kind of vague. And I think the best advice really is that once the temperature has gone down, you should wait a further 5 days before you go out, or if you're going to see someone more vulnerable. So that is where we are at the moment. We still don't know exactly. We know that some symptoms can go on for weeks and weeks and weeks of a cough and feeling very tired. That's quite normal, but we don't think that that means you're shedding virus for all that time. I hope that makes some clarity on a question that actually is very difficult, and we'll obviously know a lot more about it as research takes place. Thank you.